Faith, step away from the billing terminal and keep your hands where I can see them.
You're interrupting a medical business you don't understand.
Faith Newton did this across 5 separate fraud architectures simultaneously, running for 4 straight years. Once is a mistake. Twice is suspicious. She did this thousands of times and left a paper trail for every single one.
Thousands of home health visits that never happened.
Those records passed every review they were supposed to.
Patients never received the care you billed.
That's your opinion.
She would not get the chance to explain. Within 72 hours of that exchange, federal agents from the FBI Boston Division, HHS Office of Inspector General, and IRS Criminal Investigation would have her billing records, her payroll ledger, her training files, and 2 canceled checks for $2 million each that she had written to herself and her husband in January of 2017 and backdated to look like Christmas bonuses from the year before. 4 years of Arbor Home Care Services, LLC. $100 million billed to MassHealth. Phantom visits, forged training certificates, kickbacks, and the most vulnerable patients in Massachusetts treated as line items. By the end, the United States would order her to pay back $99,734,517. Before we go any further, I have to ask you something. How well do you actually know the people running the home care agency, taking care of your elderly mother, your disabled brother, your grandmother with dementia? Drop a comment and tell me. And if you're not subscribed yet, now's the time. We hold these operators accountable every single week because nobody else is doing it for the families on the other end of these schemes. Faith Wanjiru Newton was born in Nairobi, Kenya, in the late 1960s. The third of 6 children in a middle-class household. Her father worked for a regional accounting firm. Her mother taught primary school. The family lived in a tile-roofed bungalow with a small kitchen garden in the back, and Faith grew up watching her mother stretch a teacher's salary across school fees, uniforms, and a household that always had at least one cousin staying with them. People who knew her as a teenager described her as bright, ambitious, and unusually good with numbers. Her secondary school report cards used words like meticulous, composed, and confident. She came to the United States in her early 20s on a student visa, landing first in the Boston area, where a network of Kenyan immigrants had already started building a foothold in the regional healthcare workforce. She enrolled in community college courses while working overnight shifts as a certified nursing assistant at a long-term care facility in Lowell, earning $7.20 an hour to start. Co-workers from that period remember her as the one who memorized every resident's preferences, who arrived 20 minutes early, who never called out. One supervisor's evaluation from the late 1990s described her as reliable, detail-oriented, and demonstrating strong aptitude for healthcare administration. She married Winston Newton, a fellow Kenyan immigrant who worked as a delivery driver in 1999. They settled in Lowell at first, then moved to a modest split level in Tewksbury, then eventually to the wooded suburb of Westford as her career advanced. They had 2 children. Faith kept working. She finished her associate's degree in Health Services Administration at Middlesex Community College in 2003, then took night classes at a satellite campus toward a bachelor's in healthcare management. People who knew her in those years describe a woman of relentless forward motion. By the late 2000s, Faith had moved from direct patient care into the back office of home health agencies. She learned how Medicaid billing worked. She learned which procedure codes paid what. She learned the difference between a skilled nursing visit and a home health aid visit, what each was worth, and where the documentary threshold sat. She learned which agencies cut corners and which ones did not, and she watched the ones that cut corners get away with it for years before anyone bothered to look. In January of 2013, Faith Newton and a co-owner formally launched Arbor Home Care Services, LLC. The office was a modest suite of rooms above a strip mall in Chelmsford, Massachusetts, just off Route 3. She applied for MassHealth provider credentialing. She built out a roster of home health aides recruited primarily from the Kenyan community in Greater Boston. She rented office furniture, ordered company polos, printed business cards with her name and the title Chief Operating Officer. From the outside, Arbor looked like exactly the kind of small, immigrant-led business that the Massachusetts home health care system depends on. Neighbors in Westford described the Newtons as quiet, polite, church-going. The kids played youth soccer. Faith volunteered occasionally at school fundraisers. She was the kind of mother who organized the snack rotation and remembered birthdays. To everyone who knew her in the suburb where she lived, she was a hard-working immigrant who had made it. To understand what Faith Newton did, you have to understand how MassHealth Home Health Care Administration actually works. MassHealth is the Commonwealth of Massachusetts' Medicaid program, and it covers in-home health services for the most vulnerable residents in the state: elderly patients living alone, disabled adults, people recovering from strokes, surgeries, traumatic injuries, people with chronic conditions who need a home health aide to come in 2 or 3 times a week to help with bathing, dressing, mobility, medication reminders, and basic skilled nursing tasks. The entire program exists for one reason. It is cheaper and more humane to keep someone in their own home with a few hours of professional help than it is to warehouse them in an institution. The operational architecture of that program runs on trust. A MassHealth credentialed home health agency submits a plan of care for each patient, signed by a physician. The agency then bills MassHealth for the home health aide visits and the skilled nursing visits documented in that plan. Aides clock in, aides clock out. Nurses write notes describing the clinical care they delivered. The agency submits those records to MassHealth and gets reimbursed at a per-visit rate. The entire system rests on 3 foundational presumptions. First, that the visits actually happened. Second, that the home health aides providing those visits had completed the 75 hours of training that Massachusetts state law requires before anyone can be paid to deliver in-home health services. Third, that the patient referrals coming into the agency were based on actual medical necessity, not on side deals. If any one of those 3 presumptions fails, the entire billing architecture collapses into fraud. The institutional check on a bad actor agency is supposed to come from MassHealth's Program Integrity Unit, from the HHS Office of Inspector General's audit cycles, and from periodic compliance reviews. But those audits are infrequent. They are reactive. They are statistical. They look at outliers, at patterns, at agencies whose billing spikes look strange. They do not look at every single visit note. They do not call every single patient. They do not verify every single training certificate. The presumption of honesty is what holds the system together. It is also the gap a determined operator can drive a truck through. Faith Newton understood every layer of that architecture better than the auditors did. She had spent 15 years inside the system. She had watched it from the cot of a nursing assistant. She had watched it from the desk of a billing clerk. She had watched it from the office of a small agency. By the time she opened Arbor in January of 2013, she knew exactly which doors did not lock. The scheme started small. Within the first 3 months of Arbor's operation, Newton was already billing MassHealth for home health aide visits that had not actually occurred. The mechanics were straightforward. An aide would visit a patient once or twice in a given week, and the agency's records would reflect 4, 5, sometimes 6 visits. The aide would not contest the inflation, because the aide was a member of a tight-knit immigrant community, where the agency owner held the work visas and the rent money and the future. The patient would not contest it, because the patient was elderly, often confused, often grateful for any attention at all, and certainly was not auditing their own MassHealth explanation of benefit statements. Then Newton scaled. By the end of 2013, Arbor's billing volume had doubled. By the end of 2014, it had quadrupled. The phantom visit architecture expanded into a full machine. Newton instructed co-conspirators inside the office, including a licensed practical nurse named Winnie Waruru, to manufacture nursing visit notes for visits that had never happened. The notes were copy and pasted from a small library of stock templates. Vital signs were invented. Clinical observations were duplicated word for word across dozens of patient files. A patient in Lowell would have the same exact note as a patient in Lawrence, with the same exact symptoms documented on the same exact day. Anyone reading two files side by side could have spotted it in 30 seconds. Nobody read two files side by side. The second layer was the home health aide training fraud. Massachusetts state law requires every HHA to complete 75 hours of formal training before providing services. The training covers infection control, patient transfer techniques, vital sign measurement, basic medication safety, and the protection of patient dignity. Arbor never provided that training. Newton hired aides off the street, off referrals from the Kenyan community, off whoever was available. She handed them a polo shirt, a clipboard, and a patient address. To paper over the legal requirement, she forged the training certificates. She prepared sham examinations and handed out the answer keys along with the test booklets so that the new aide could fill in the bubbles and produce a passing score on paper. The certificates went into the personnel file. The personnel file went into the audit binder. The audit binder went on the shelf, and the patient in Methuen got bathed by someone who had never been taught how to safely lift a person out of a wheelchair. The third layer was the kickback architecture. Newton paid people to refer patients to Arbor. The payments went through informal channels, sometimes cash, sometimes checks routed through shell vendors, sometimes via reciprocal arrangements where Arbor would refer patients in the opposite direction. The medical necessity question never entered the conversation. Whether the patient actually needed home health services was irrelevant. What mattered was the patient's MassHealth eligibility, the per-visit reimbursement rate, and the volume the agency could push through the billing pipeline. The fourth layer was the sham family employment architecture. Newton would identify a MassHealth-covered patient whose family member was willing to play along, and she would put that family member on the Arbor payroll as a home health aide. The family member would then bill MassHealth for visits to their own relative. Some of those visits were marginal, but at least real. Many of them were entirely fictional. A daughter living 3 states away would appear in Arbor's records as having delivered 8 home health aide visits in a single week to her mother in Brockton. Newton signed off on all of it. The fifth layer was the doctor pressure architecture. Plans of care require a physician's signature. Newton's office flooded primary care clinics across the Merrimack Valley with stacks of pre-filled plans of care for patients who did not need home health services, pressuring overworked physicians to sign off on the paperwork as a routine administrative task. Some doctors signed, some did not. Enough signed. By 2015, Arbor was billing MassHealth at a volume the size of an agency 3 times its actual operational footprint. The reimbursement checks rolled in. The Newton's lifestyle followed. In 2015, Faith bought a Maserati. The car cost over $100,000. She parked it in the driveway of the Westford home, which she and Winston had upgraded to a larger property on a wooded lot. She wore designer clothes to church. She paid private school tuition for the children. She traveled. No one inside the office stopped her. Some of the aides knew, some of the office staff knew. Winnie Waruru, the LPN, knew the whole architecture because she was helping construct it. But the office ran on the same dependency structure as the patient care side. Newton controlled the paychecks. Newton controlled the immigration paperwork for several employees. Newton controlled the references, the schedules, the future. People said nothing because saying something cost everything. By the end of 2016, Arbor had billed MassHealth for roughly $100 million over the course of 4 years. We're about to get to the moment it all came apart. Before we do, if you've made it this far and you appreciate the way we break down exactly how these schemes operate, subscribe and hit the notification bell. These stories don't get the mainstream coverage they deserve, and the families on the other end of cases like this one deserve an audience. In the early months of 2017, MassHealth's Program Integrity Unit ran the kind of statistical analysis that should have happened in 2014. Arbor's billing patterns flagged. The volume was inconsistent with the agency's actual staffing footprint. The patient roster contained anomalies. The nursing visit notes showed duplicative language across files. The training certificate documentation showed the kind of clean uniformity that real-world training records never have. In January of 2017, MassHealth cut Arbor off. The provider credentialing was suspended. The reimbursement pipeline closed. The $100 million machine stopped, mid-cycle, with claims still in the queue, payroll still going out, and the entire business model dependent on a continuous stream of incoming MassHealth payments. For most operators in Newton's position, the cutoff would have triggered immediate damage control. Lawyers, compliance consultants, a formal response to MassHealth, a negotiation, a wind down. Faith Newton did something else. Within days of the MassHealth cutoff, Newton wrote 2 checks from the Arbor payroll account. One check made out to herself for $2 million. One check made out to her husband Winston for $2 million. Total, $4 million, drained from the agency's operational account in a single stroke. Then she did the part that would later sit at the center of the federal indictment. She backdated both checks to December of 2016. She wrote them in January of 2017, but she dated them as if they had been written the previous month. On the memo line, she wrote the words Christmas bonus. The cultural framing of the choice was striking. Christmas bonuses are a recognized fixture of small business employment culture, a year-end thank you, an expression of gratitude from an employer to the staff who carried the business through the year. Newton repurposed that cultural symbol as a fraud cover-up vehicle. She took the language of holiday gratitude, the iconography of the year-end check, the small business tradition of writing a bonus check before the calendar turned, and she weaponized it to disguise a $4 million self-payment as a routine prior year transaction. She deposited the checks. The money cleared. What she did not know, what she could not have known in that moment, was that the same statistical analysis that had triggered the MassHealth cutoff had also triggered something else. The matter had been referred. The FBI Boston Division had opened a file. HHS-OIG Boston had been pulled in. IRS criminal investigation, working out of the Boston field office, was already pulling Arbor's bank records. They were looking at the agency's payroll account. They saw the $4 million leave. They saw the dates on the checks. They saw the memo line. And they began the slow, methodical, document-by-document reconstruction of every layer of the 4-year scheme. The joint investigation was led by FBI Special Agent in Charge Jody Cohen of the Boston Division, HHS-OIG, Special Agent in Charge Roberto Coviello, and IRSCI Acting Special Agent in Charge Thomas DeMeo. The case file moved through the U.S. Attorney's Office for the District of Massachusetts. From the outside, an investigation of this scale looks dramatic. From the inside, it is mostly paperwork, subpoenas, bank records, patient interviews, aide interviews, doctor interviews, hours of records review under fluorescent lighting in a federal office building. The paper trail told a story even the most aggressive defense attorney would struggle to spin. Arbor's billing records were cross-referenced against patient interviews. Patients reported they had not received the visits the agency had billed for. Some patients had received 1 visit a month, and Arbor had billed for 8. Some patients had never received a visit at all. Some patients had been dead for months, while Arbor continued to bill MassHealth for ongoing home health aid services. The training certificate fraud unraveled the moment investigators interviewed the aides themselves. None of them had completed the 75 hours of state-mandated training. Most of them had spent less than a single day in any kind of formal instruction. Several of them produced the exam booklets they had been handed alongside the answer keys, the same exam booklets that had then been filed in the personnel records as evidence of compliance with state law. The kickback architecture surfaced through bank records and informant testimony. The sham family employment architecture surfaced through payroll records, cross-referenced against patient location data. The doctor pressure architecture surfaced through interviews with primary care physicians who described the volume of pre-filled plans of care that had been delivered to their clinics for signature. And then there were the bonus checks. The 2 checks Newton had written in January of 2017 and backdated to December of 2016 sat in the IRS criminal investigation file, like a confession written in her own hand. The check stock itself bore micro-printed dating evidence. The bank's intake records showed the actual negotiation date. The agency's general ledger had been hastily adjusted, but the audit trail in the accounting software still reflected the January entry. The metadata on the digital records pointed directly at the manipulation. The federal prosecutors had what they needed. The indictment was returned in February of 2021. Faith Newton was charged alongside co-defendant Winnie Waruru, the LPN who had been generating the falsified nursing visit notes inside the Arbor office. The charges included conspiracy to commit healthcare fraud, conspiracy to commit money laundering, and multiple counts of money laundering. The restitution figure attached to the indictment crossed into 9 figures. Federal agents executed the arrest warrant at the Westford home on a cold morning in February of 2021. The Maserati sat in the driveway. The agents knocked. Newton answered the door in a robe, her hair wrapped in a silk scarf, a coffee mug in her hand. She looked at the badges. She looked at the warrant. She looked at the line of vehicles parked on the quiet suburban street. She asked one question. "Is this about the agency?" The lead agent told her she was being placed under arrest on federal healthcare fraud charges. He read her the warrant's caption. He explained the process. He asked her to put down the coffee mug. "I cooperated with MassHealth," she said. "Everything we did was documented." The agent told her she would have the opportunity to discuss the case with her attorney. "My husband had nothing to do with the agency," she said. "He just drove a truck." The agent repeated that she would have the opportunity to discuss the case with her attorney. She was processed at the federal courthouse in Boston later that morning. She was released on conditions pending trial. She returned to the Westford home. The Maserati was eventually seized as part of the asset forfeiture proceedings. The house entered a complicated legal status as collateral against the eventual restitution order. Her children, by then both teenagers, watched their mother's name move from the local Westford community Facebook groups into the Boston Globe. The trial was set for the summer of 2024. In the 3 years between arrest and trial, Newton remained in Westford under supervised release conditions. She attended church. She walked the neighborhood. She did not testify in her own defense. Winnie Waruru, the co-defendant, did not go to trial. In September of 2022, Waruru pleaded guilty to conspiracy to commit healthcare fraud aiding and abetting, conspiracy to pay and receive kickbacks, 2 counts of making false statements, and 1 count of making a false statement in a healthcare matter. Her sentencing was deferred pending her cooperation with the government in the case against Newton. The trial began in July of 2024 before United States Senior District Court Judge George A. O'Toole, Jr. at the John Joseph Moakley United States Courthouse in Boston. The government's case ran for several weeks. Prosecutors called former Arbor employees who described how the falsified nursing notes had been generated. They called home health aides who described the absence of the 75 hours of training. They called patients and family members who described visits that had never happened. They called the federal agents who walked the jury through the bank records, the payroll ledger, the metadata on the digital files, and the 2 backdated bonus checks. The defense strategy was to challenge the government's accounting, to attempt to disaggregate the $100 million figure into smaller, more defensible billing disputes, and to position Newton as an immigrant entrepreneur in over her head, rather than a deliberate architect of a multi-layered scheme. The strategy ran into the documentary record. The records did not show an overwhelmed operator making innocent errors. The records showed a methodical, 4-year, multi-layered architecture of fraud, capped by a January 2017 self-payment of $4 million, disguised as a prior year Christmas bonus. The jury deliberated. On a humid July day in 2024, the 4-person returned the verdict. Guilty on 1 count of conspiracy to commit healthcare fraud. Guilty on 1 count of healthcare fraud. Guilty on 3 counts of money laundering. Not guilty on 1 count of money laundering conspiracy. 5 of 6 counts. The conviction was effectively total. Sentencing was set for January 23, 2025. On that morning, Judge O'Toole convened the courtroom. The U.S. Attorney's Office, by then under the leadership of United States Attorney Leah B. Foley, presented the government's sentencing position. The restitution number, calculated to the dollar from the Arbor billing records cross-referenced against the actual delivered care, was $99,734,517. U.S. Attorney Foley addressed the court. Ms. Newton used the home health care agency she operated to perpetrate a massive years-long fraud scheme that siphoned over $100 million from a program designed to support our most vulnerable residents. FBI Special Agent in Charge Jody Cohen issued a statement that same day. Faith Newton betrayed the trust of her patients and their families when she used them as pawns in a massive $100 million home health care fraud scheme to fund her lavish lifestyle by paying kickbacks and billing for services she never provided, treatments that were not medically necessary, and visits by sham home health aides who were not certified or trained. It's clear that the guiding principle here was greed. Judge O'Toole addressed Newton directly before pronouncing sentence. He spoke about the trust the program had placed in her. He spoke about the vulnerability of the patients whose names had been used as billing instruments. He spoke about the deliberateness of the 4-year scheme, the conscious effort to falsify training documents, the use of family members as billing pass-throughs, and finally, the post-cutoff self-payment disguised as Christmas bonuses. He noted that the scheme had not been an isolated lapse. It had been an architecture. The sentence was 12 years in federal prison, followed by 3 years of supervised release. Restitution of $99,734,517. A fine of $250,000. Faith Newton was designated to a federal correctional facility within the Bureau of Prison System. Her projected release date sits in the mid-2030s, assuming credit for good conduct. The Maserati was long gone, sold off in the asset forfeiture proceedings. The Westford home entered an extended process to satisfy the restitution order. The $99 million restitution figure is, by any practical measure, unrecoverable. The money is gone. It went to a Maserati, to a house, to designer clothes, to private school tuition, to 4 years of a lifestyle funded by visits that never happened, by training that was never delivered, by patients who never received the care MassHealth had paid for. The co-defendant, Winnie Waruru, remained awaiting sentencing on her own guilty plea. She faced her own federal exposure for the role she had played inside the Arbor office. The broader institutional question hung over the case. The MassHealth program integrity architecture had eventually worked. The statistical anomaly had eventually surfaced. The audit had eventually triggered the cutoff. The federal investigation had eventually delivered the verdict. But the operative word in every one of those sentences was eventually. 4 years had passed. $100 million had moved. Thousands of falsified records had been entered into a state Medicaid database that exists, fundamentally, to serve the most vulnerable people in the Commonwealth. The Newton case became the contemporary federal benchmark for how a determined home health agency operator could capture the credentialing and billing architecture of a state Medicaid program. Reforms followed. Visit verification technology requirements expanded. Training documentation auditing tightened. Kickback enforcement intensified. The conversation about how to harden the system against the next Faith Newton continues at the state and federal level. But Faith Newton herself sits inside the Federal Bureau of Prisons until the mid-2030s, with a restitution order she will never repay and a sentence that captures, as precisely as the federal guidelines allow, the gap between what she was trusted to do and what she actually did. This case was massive. But the case on the right-hand side involves a small-town operator who pulled the same architecture in a fraction of the time. Click it now.